Good afternoon. I'm Patty Johnson, Coordinator of the Southeastern Council of Foundations Engagement Initiative. This afternoon we're delighted to present our program, Living Beyond Expectations. It is hosted by the Community Foundation for Greater Atlanta, represented this afternoon by Tanae Traylor, and presented by Kathryn Lawler from the Atlanta Regional Commission. I'm going to turn the program over to Tanae for now.
Thank you, Patty. Again, my name is Tanae Traylor. I'm a Senior Program Officer here at the Community Foundation for Greater Atlanta. And we are very excited to partner with Patty and the Southeastern Council to host this webinar focused on aging. A bit about the Community Foundation for Greater Atlanta. We serve 23 of the 159 counties here in Georgia, and our work is really centered around 4 major goals. The first is to engage philanthropists. The second is to strengthen the region's nonprofits. The third really is around practicing organizational excellence. And the fourth is advancing public will. The work that we are doing to advance public will is to lead and participate in collaborative efforts to provide solutions to community problems, often partnering with other funders, nonprofits, and individual donors. Our partner and friend for a number of years is the Atlanta Regional Commission. The Atlanta Regional Commission is our regional planning and intergovernmental coordinating agency for our metro Atlanta area. They serve 10 counties here. Although we partner with ARC to host discussions and support efforts on transportation and housing and health and wellness, and just a host of other regional issues, aging is one of the most comprehensive issues that ARC tackles. We've been in communities as the Community Foundation for a number of years, but our most grounded work really is centered around our neighborhood fund. And that's where we really had an opportunity to see ARC at work. And so ARC has been a real thought partner as we delve deeper to advance residents who are focused and energized in collective hope and intention. And with that said, please allow me to introduce Kathryn Lawler with ARC. Kathryn will be presenting Living Beyond Expectations, Shaping Communities for Living Longer. And I just wanted to give a little bit of background around Kathryn. Kathryn's title is External Affairs Manager at ARC. And before working at ARC, Kathryn worked with communities across the U.S. striving to become more age-friendly, including 4 years as the Director of Aging Atlanta, a Robert Wood Johnson Foundation partnership. Kathryn focused on preparing the metro region for the rapid growth in the older adult population. Kathryn was a fellow at Harvard University's Joint Center on Housing Studies and served as the staff to the Congressional Commission on Senior Housing and Health Care in the 21st Century. Kathryn is an amazing woman, and we're really excited that she'll be presenting Living Beyond Expectations. Kathryn.
Thank you. Thank you so much, and I'm really glad to be with everyone this afternoon, and thanks for taking the time. It's my great pleasure to tell you about the work that we've been doing here in Atlanta, some of the why we've been doing it, and a little bit on our history, and then to kind of explain where we're going with it, where we find ourselves about 9 years into this work, what our future directions will be. And I know that some of you have been studying the whole concept around age-friendly communities and working with older adults through this series and others, and some of you may be new to it. So I'd like to provide you a little bit of background on what we've been doing, but also any more detail that you'd like, I hope you will ask questions. So let me tell you a little bit start with the why we're doing this work in Atlanta. And really it's the same why for many people across the country. And that is a real initial recognition on our part that things are really changing. Society is changing, community is changing, and we have talked for a long time about the aging of the baby boomers. It feels like maybe since the baby boomers were born we began to talk about what it would be like for them to grow older. And that's really important, that sort of general trend, but the general trend doesn't tell us a lot about what we need to do, when we need to do it, and how we need to do it. And what we began to understand in the Atlanta region is that providing basic services to older adults is very important, but we needed to fundamentally understand where they live, that place really began to matter, and it could either hinder our ability to meet their needs and keep them in the community, or it could really facilitate the ability to do that. So, a little background on, and I expect you're very familiar with these numbers, but we always like to stop and reflect on them a little bit, because it's not just the growth of the older adult population. It's really this profound shift that's driven by longevity. So while we have a lot more older people, and that's very important, and that is driving a lot of the conversation and the planning and the rethinking of service delivery that's going on, one of the fundamental issues is that no community is staying the same. And that is just simply because we are living so much longer. So this is just some numbers about how fast that has grown and changed. I was just in a meeting this morning talking again about how low life expectancy was just 100 years ago, and how significantly the change was, and most importantly, how fast that has been happening. And of course, the exciting thing is that we're living much longer, but the speed at which that's happening means we haven't had a tremendous amount of time to figure out how to do that. And I know you've seen similar to this, but I just thought I'd show you where we are in Georgia. So these are population pyramids, and you can see in 2000 in Georgia we were still pretty triangular in our shape, so a lot more younger people than older people. And it's funny, in the Atlanta region, one of our challenges with this work is that we consider ourselves very young. So if we, even while sometimes individuals have denial issues about growing older or whatever, we have those as a region often, because we have just for so long been in the southeast and been a place where young people come, and it turns out, in fact, we are growing older much more quickly than many other places. And really by 2030 you can see that Georgia, just like many places around the country and around the world, is moving away from that triangular shape to more of a rectangle. And whether those shapes aside, what that means is that all of society is changing. This isn't just a conversation about older people. It's the whole structure of our communities. And so if anyone who is attempting to serve people, to build quality places, to provide for the needs of anyone in community, has to be thinking about this fundamental restructuring of how we live together, defined by the fact that we have many more old people in comparison to younger people, that we are living much longer, and that we have this brand new experience of getting older, and we're in a period of reinvention. And just to show you what that looks like here in the Atlanta region, let's see, Patty, I'm trying to switch to slide 6. And there we go. I'm sorry, I think I hit the wrong button. So these are the 10 counties that we serve. And so if you're familiar with the Atlanta region, these are just, you've got the city of Atlanta, and these are all the counties that immediately surround it. And a very interesting way to understand this profound change in society and community is looking at the data on median age. So what is median age? It simply means that half of the population is younger than that age and half of the population is older than that age. And these initial blue lines here are 1970, and you see we were a very young place. You have counties where the median age, like Clayton here, was 23. So you have a half of the population younger than 23 and half of the population older than 23. Even places that were older where the median age was really 26. So a very young place in 1970. And then if you look at the red lines, every place began to get older. But over a decade, not so much. Those are pretty small lines, the red lines. And then looking at 2000, so if we go out 20 years, how much median age has grown. And so you see places like Fayette County, which is, if you've ever flown into the Atlanta airport, it's not that far from the Atlanta airport. It's south of the city of Atlanta. In 2000, where median age was close to 38, so a very big difference. Half of the population over 38, half of the population younger than 38. Again, a smaller county to the west of Atlanta, Douglas County, again looking at 35 as a median age in 2000. So a real difference in the whole community. This isn't just a question about aging. And then purple, and then we look all the way out into these sort of more turquoise lines. You see where our modeling predicts we might be. We continue to get older, and really extraordinarily, if you look at that long line of Fayette County predicting a median age of close to 57 by 2040. And that's really remarkable. That would be an extraordinary thing if that projection plays out in that county. Look at a place like Rockdale where it's 45, Cherokee closer to 40 and a half really. That's such a complete shift. Those projections may or may not hold true, but what's interesting is that the policies in place are a part of fueling those projections. So if everything stays the same in those counties, that's where we expect it to go. And I think it's a great example of why thinking proactively about place, about community, about who lives there, and if you're going to ask those questions in the 21st century, you will find that you're talking about longevity and growing older, and that's certainly what we've found in the Atlanta region. Now, if you've ever been to Atlanta, all during this time, so if we're looking at statistics from 1970 and then projecting into our future, while we were growing older, we actually built communities that weren't necessarily good for older people, that we're ignoring this trend. We're a highly auto-dependent community. We are a good place to be young, but not necessarily a good place to grow older. And that's had some real consequences. Very specifically, you can look at where we are in terms of health. And if you're from the Southeast, it's not something any of us are proud of that the Southeast tends to hang in the bottom of some of these national health statistics. But when it comes to older people in Georgia, we are at the bottom or very close to the bottom on a number of critical aspects. So while we've been growing older, we've actually been getting less healthy over time. So ignoring this trend, not contemplating how society is changing, not building communities that are supportive of all people, places where they can live high quality of life, healthy lives, has resulted, at least in Georgia, in these kind of statistics. But it's happening all across the country as well. And there's sort of this real question about, can we afford this change? And just some simple statistics here. I'm sure you've seen some of these numbers about what it takes to just the cost of chronic disease. So if we are going to live much longer, but because we are not healthy as we need to be, then we have this really tremendous price tag that comes with longevity that's not necessarily positive, that it's very expensive to longevity if the equation continues to remain growing old in a community that's not ready to be supportive. It gets really expensive. Sort of on this other question of are we ready, can we afford this, I expect you've seen some of these numbers too, but even as individuals, and these are national statistics about can we really afford longevity, are we preparing for being able to live this much longer? Not necessarily so. Many people, you can look at these statistics yourself, but who are having a hard time finding a way to save. And when retirement wasn't very long, that wasn't as much of a problem. But when we are retired for 20 and some people 30 years, it's a really significant thing to be able to plan and not only have the resources in terms of your health, but also the financial resources. So longevity can get really expensive if we're not being proactive and thinking about really preparing for that both individually, as families, and then as a community as a whole. So it's not something that ignoring it really works out so well. It can be very expensive. And then I mentioned, in Atlanta, we did this funny thing, which was build these kinds of communities. This is, you've seen it before, I'm sure, Never Never Land, and this is, of course, the only place where you never grow old. And so much about the way we have invested our infrastructure, not only since 1970 and those numbers we looked at earlier, but all the way since 1950. Are really just completely ignoring the fact that we grow older. So our almost exclusive investment in one mode of transportation, that being you have to drive yourself in your own car in order to get anywhere, is doesn't make a lot of sense when you have the early part of your life where you're not allowed to drive, and then of course the later part of your life, which as we grow older is a very significant percentage of your life, where individuals are not comfortable or over time maybe not as physically able to drive. So that just sort of singular investment where we, every time we do that one solution fits all, that's not going to work for a diverse community that's going to live much longer. We have also segregated housing types. So we don't have a mix of housing where people could stay in the same community as their needs change. So individuals who've raised their families in neighborhoods in and around Atlanta find that when they're ready to downsize, or perhaps when they need more support, or even when they're ready to move their parent and would like their parent to live close by, because of policies that we have that make it very difficult for different types of housing to be located close together or in the same community, they find that it's not actually possible to live in the same place, and that when you have a change in your housing need, you actually have to change your whole community, and even though you may have lived there 30, 40 years. So we've made some really significant decisions and invested billions and billions of dollars, but simply not looking at this one really profound issue, which was the advent of longevity. So where that gets us is in this funny equation, and an equation that doesn't necessarily add up, right? So we have longevity. We've got lots and lots of birthdays, more than anyone ever has before. This wasn't a problem a long time ago because we simply didn't live very long, and now we get to live a lot longer, and it's a pretty great thing. I have yet to find people who are ready to sort of turn back the clock on longevity. But we did that in a world where we invested and built structures and organized ourselves as communities in a way that really pretends that we don't grow old. So everything from how we help people save to how we help people get healthy and stay healthy to where they live and how they get around, all of those things have in most places been done pretending that we don't grow old, which is a really funny thing. And it's an equation that has added up to what these solutions to aging. So what do we tell people to do? Save a lot of money, eat healthy foods, and do some things like change your doorknobs so you have levers instead of doorknobs that turn. And what we're finding, of course, is that this equation, telling people to save a lot of money, eat really healthy, and do these small things, that's not adding up for people. I mean, most of these things that we've suggested people can do are things that human beings are really bad at doing. Human beings are really bad at saving for the future, and as we know, really bad at making good, healthy food choices. And a doorknob isn't going to work if the sidewalk's broken out in front of your house or there's nowhere to walk to anyway. So all of this has driven us to developing what we call kind of the longevity to-do list. And this is what I would argue is going to define communities throughout the 21st century. Communities that get this, that get that they need a longevity to-do list, will thrive in the 21st century. Longevity will be the defining feature. There'll be lots and lots of different interesting technologies that come around. There'll be things that we can't even dream of right now that occur in this next century, but clearly longevity and its complete restructuring of society is going to be a major defining component, and will be the thing that communities either succeed in understanding and use as a way to thrive, or they find that they missed the boat and they're not able to keep up with the needs of people who live there, and people will move other places. So on the longevity to-do list is transportation finance. So really fundamentally rethinking the way we spend our transportation dollars. And that isn't just about roads and bridges, but it certainly is. It's about all ways of getting around. So the entire suite from certainly we need safe roads and safe drivers, but we also must have alternatives to the car, and we must have communities where it is safe and a viable option to walk to at least get basic needs. It's interesting, as I have for many years talked to different groups around the Atlanta region about creating communities that work better for people of all ages, and particularly older people. Everyone in Atlanta is ready to get rid of their car. We're notorious for our traffic. Nobody likes it. And it's very strange. When you are in Atlanta and you go to a meeting, the whole first 3 or 4 minutes is about people's war stories about what it took to get there. If you go to cocktail parties, it's what people talk about is traffic. Nobody's in love with their car here. However, it's the only way for them to get around, and that's not going to work in the future, and we have to start spending our money in a different way. We have to fundamentally rethink all kinds of infrastructure design, whether it's parks or housing or community facilities, where we put our retail operations, where we put our libraries. All of it has to be rethought, thinking about the whole course of longevity, but particularly this new phenomenon of growing older. We can no longer afford to build communities and build infrastructure in those communities that are pretending that we don't grow older, and there's a lot we could talk about on that. Lastly, on the longevity to-do list for us is really beginning to work on health and creating health, and to do so in a way that's reflective of the real causes of unhealthy behavior, and therefore the real solutions to good healthy behavior. So I'm guessing many of you are familiar with the general concept of the social determinants of health, understanding that health care actually plays a pretty small role in creating health, but it is around healthy behaviors. It is around all the community life, the socioeconomic factors, and places where people live. Those can combine, play have a tremendous impact on how healthy people are. And both the cheapest and the highest quality way to enjoy longevity are to be as healthy as possible. But when we look at how we're spending our money both nationally and in our region here, is we spend all our money on this one thing, health care, that doesn't necessarily provide us with the outcome we're looking for. So we spend a lot of money in an area that actually has a relatively small impact on health. And so we have helped lead the development of a larger regional health collaborative to look at realigning locally the way that we spend our healthcare dollars to be more reflective of the real causes of health issues, which is aligning them more with the social determinants of health. So beginning to spend our money less on formal health care and more on the communities where people live, their ability to be economically stable, and changing their unhealthy behaviors into healthy behaviors. Well, how have we been doing this? I just wanted to show you this kind of example of how our thinking has evolved. And so when we began to understand a lot of the issues facing older people, and knowing that as a major aging service provider, we weren't going to be able to make this change on ourselves. And that in the fact there were other organizations and agencies and funding sources that were all having a huge impact on the quality of lives that older people were living in the Atlanta region. And like this diagram shows you, we pretty much didn't interact with them. So each of us kind of head down our own direction. We've used the term for so long now, silos. We all know what that means, working separately, oftentimes parallel. We found even in our own organization that sometimes people on one floor are not communicating with others on another floor about issues they actually had in common. That is, our transportation planning division not contemplating the needs of older people, and yet the head of that division actually shared a wall with the head of the aging division. So, these disconnect was very, very profound, and probably led to the way the communities that we had, which were not communities that were reflective of this great gift of longevity. And so over time we've begun to work more collaboratively together, thinking about how we can do that, and we've spent a number of years reaching out and working in the community, helping what we create kind of call those light bulb moments, where across sectors and as communities as a whole beginning to understand what's going on in terms of the growth of the older adult population and what's happening right in their backyard and what are the impacts, but also the economic opportunities of understanding that change. So really beginning to communicate and work together. I used to say that when we would try to partner with new agencies who maybe never contemplated working with the aging division, it was never about meeting each other halfway. We would have to go 95% of the way. That you have to get all the way up into people's work and understand the incentives, and then we were able to build partnerships. And we spent a number of years doing this work. We've got 10 counties and 72 cities in the metropolitan area reaching out a number of very exciting pilot projects, including a massive region-wide charrette that the Community Foundation helped support, bringing together over 1,500 people from across the region to contemplate how could the region be a place for people of all ages and all abilities, and actually design 6 communities together that could be places for people of all ages. But as we look forward to the future, we're looking for a new way to work, which is sort of beyond the initial stage of collaboration and fundamentally beginning to integrate what we do as aging professionals into what pretty much everybody else does. When you're trying to think about impacting all parts of community and society, there's sort of no area that is off limits.
My other phone because this keeps beeping.
And this has been a real new way of working, and it's where we find ourselves now, beginning to get outside of our pilot projects, which have ranged everything from developing walking clubs to installing new street lighting to looking at changing out bus stops so that they were more friendly, to building new sidewalks, to doing community gardens and garden clubs, a very wide range of community-based projects that were both designed to have an immediate impact on the lives of people, but also bring people together in conversation about the kind of community they wanted to have in the future. We have been doing that for a number of years, but really thinking that this third way of working, fully integrating is where we need to go now. So living beyond expectations is kind of the new phase of that work, where what we talk about is what we know is that the Atlanta region wants to become a place for people of all ages and all abilities. We don't have individuals resisting that idea. We haven't met professionals in different sectors. We haven't met community members who don't think that's a great idea. But where we do see the next challenge is when everybody recognizes that to get there we have to change. And changing what we do, changing how we spend our money, changing our vision for the future is, it turns out, a lot easier to talk about than actually do. And so Living Expectations has been funded through Grant Makers in Aging and the Pfizer Foundation to begin to raise the level of dialogue and begin to build momentum across the region for real fundamental change, because that's going to be the hard work. It's much easier to talk about change. It's much easier to know what you need to do, but doing something different than was done 2 years ago, 5 years ago, 10 years ago, turns out to be a lot more challenging at the local level, at the county level, at the regional level, and even at the state level. So Living Beyond Expectations has a number of components to it, and I just wanted to share a little bit of that with you. One is telling stories, and we have found that the best way to talk about these issues is to tell the stories of people who have been living in the Atlanta region throughout their lives, who have gotten older and who are having both great experiences but also sometimes some challenges in the Atlanta region. So what we did was partner with our public broadcasting station. And if you're interested, we have many stories. These are just 3 highlighted here. And I actually realized these are the stories about the men, but we did have stories about women as well. And I encourage you to take a look at them. They're each only a minute long, so you could check it out at the website and view those stories. It's been remarkable to see the impact of simply watching a 1-minute video where older people in their own words describe what the Atlanta region means to them, what's making it hard for them to live here, but also what makes them still want to live here. It's been very powerful, both with local decision makers, with other older adults feeling comfortable talking about what it means to get older in the Atlanta region and how they have a right to expect a community that supports them. These have been airing on the public broadcasting station along with a half-hour television segment that's aired a couple times. I am happy to share with you that it turns out when the half-hour special we did had higher ratings than Downton Abbey, which shocked all of us, including the public broadcasting station. And I guess in public broadcasting speak, that's the biggest compliment you can get. But what was interesting about that is I don't think even we knew there would be that much interest in this topic. And the way they measure these ratings, you may know about this, that they can actually tell how long people stayed. And they found more than any show they had done so far in 2014, people began to watch the show and then they stayed and watched it till the end, which is really remarkable and really shows that what we need to do is unleash this momentum, not necessarily have to create it from scratch. We're having the culmination of some of this work, at least this year's worth of work, in an upcoming event where we are actually transforming a physical community in downtown Atlanta, 2 blocks into a lifelong community, a temporary lifelong community. And on June 19th, we will gather professionals from all across the region and some from across the country, aging professionals, planning professionals, design professionals, along with older adults themselves. And they'll spend the day learning about what are the fundamental issues, both in aging and in community planning, and how to bring those together. And we have been working for about 6 months with the community where these 2 blocks are located. So they'll be evaluating the ideas and concepts that that community put forward that that community said would make it more livable. And then on June 20th, they will actually help construct this temporary installation to make these blocks a lifelong community for the weekend. And then over the weekend of June 21st and 22nd, we will actually transform them, and everyone will come out and celebrate. So it will be a great festival in the community where you can actually experience what it might be like to, if that community was more livable for people of all ages. It's a community, it's the only urban senior center. It is a community that has churches and a library and an elementary school and a senior high-rise. But all of these are currently relatively unconnected, and there are not necessarily the resources there in terms of shops and stores so that people can accommodate basic needs. So this is a map of the area that will be transformed, and you can just see some of the highlights of the things that will be going on. There is an urban garden right there, and they will be setting up a farmer's market and touring people through the garden and teaching them how to do it. There will be music and health events all throughout the time. It's both a celebration, but it's also so that people can actually see what it might be like to have a community where a biker can feel safe, where a pedestrian can feel safe, and where a car and a streetcar could all operate in the same area, where you could actually have a bank and a restaurant and places to work and live all in the same community. So certainly if you're in the Atlanta area and want to join us, you'd be very welcome to join us for any components of this. The 19th and 20th are really a 2-part series where people learn and then learn by talking and discussing on the 19th, but then learn by doing on the 20th. And then the 21st to the 22nd is a great celebration. It's been a tremendous partnership of both private and public entities to both fund the event but also plan it, and just the process of preparing for it has built a tremendous commitment to making the temporary installations permanent. So I want to leave you with a couple last thoughts. This is often how the growing older adult population is described. It's called the silver tsunami. It's the age wave. It's often described in this sense of this massive thing about to befall us. And I generally find this the wrong way to talk about this kind of change in the community. It's very disempowering. It really suggests that we need to invest in raincoats and rowboats, kind of bear down and try to survive it, rather than use it as recognize it for what it is, which is this great opportunity of our century to benefit from the progress of the 20th century that's given us longevity, and use that to kind of ride a wave into a whole new way of being together in society and as a community. So I think it's really a time of radical reinvention. We don't think we have all the ideas, and we're always so delighted to work with communities across the country, like Kansas City who's on the phone here today, but others who are also really wrestling with these ideas and experimenting and trying. This is a time for us to begin to figure this out, and most importantly, take what works and bring it to scale. So where are we going? I think there's still a lot to be done, but this is one of the ways we've often thought about it is this is actually a street sign. It's used more commonly in Europe. I don't find it very much in the United States. And I always find that people see it, and Americans think it's a little bit offensive. And for all kinds of different reasons. But what it certainly is talking about is older people in the community. What does it mean? What are the indications? It's a signal that those two things are being thought about. In the Atlanta region, we believe that the best ideas are coming from the communities themselves, and that they know what that's going to mean to live and be older in their community. They have their own priorities on that. And so we let them define it, whatever that's going to be for them. But the most important thing is that we are thinking about longevity and community. We are thinking about how we live together, how we invest our dollars, and how we can support people of all ages. So just one last, this is me, and I am always delighted to talk with you further, both hopefully during this conversation but later as well. And I've got a lot of colleagues much smarter than I, and I'm very happy to connect you to them as well about any of these details. And at the Atlanta Regional Commission, we believe that we should share everything that we've learned, because every time we do, we learn that somebody's a little bit further ahead. So any of the stuff we've done, any of the documents we've produced, you are welcome to have them all. I also just wanted to let you know that there is a group organized through Grantmakers in Aging who's beginning to continue this conversation, and that some of you who are on the phone may be interested in joining them for their first learning circle. It's on June 12th, and they are funders who are beginning to talk about how to do that. So with that, I hope, Patty, we have some questions.
Yes, we do. I've got several in chat, and I've got one hand raised, which is Kathy's. So Kathy, introduce yourself and then ask your question. And don't forget to unmute. Wait, maybe she forgot to unmute.
Can you hear me now?
Oh, yeah, now I can hear you, Kathy.
A while to find my note on how to unmute. And I was actually starting to type it in, so I was typing. Kathryn, I noticed on one of the slides that you're indicating that 6,000 people are turning 65 every day. So this is lower than what we generally see. So is there a new source now that's coming out saying that the number is 6,000 rather than 8?
No, Kathy, I think that that's probably we could go back and double check that. I think we had pulled, because of all of those statistics together, they were based on some study about retirement savings. So I can get that source from you and we can compare it, because I don't think it should be lower than that national statistic.
Okay. Thanks.
Okay. Thank you, Kathy. Deborah Jacobs from the Patterson Foundation had several questions, one on the leadership team and measuring success. Deborah, would you like to ask the questions yourself?
Did I demute okay?
Yes.
All right. So, yeah, Kathy, could you talk, because this is a community movement kind of campaign that you're working on, is there a community leadership team? And if so, how's it constituted?
Yes, no, that's a great question. So we have had a diverse group of people developing and advising this work since its very beginning, which, as I mentioned, I think we can trace its origins back 7 or 8 years in the Atlanta region when it began to get formalized. And it's really a mix of, because the Atlanta Regional Commission, we are a coalition of local governments. And so we have a tremendous amount of local elected officials and their staff involved in this work, because that's kind of where we come from. But we've never done anything without the direct input and of those we are attempting to serve. And so we have many older people involved, as well as individuals who are caring for older people. You know, I always say that in the Atlanta Regional Commission, we look out at the population, see only two kinds of people, current older adults and future older adults, because that's the whole region. So we have a mix of individuals involved. Various elements of the work have had different specific partnerships. So for example, what's coming up in June has been a collaboration of the local residents, the county commission, the city council, the business association, the area health clinic, the neighborhood associations. There's been foundation funding. There's been private corporation funding and public sector funding as well.
Hello?
And my other question is could you just talk about how you measure success, short-term, long-term, however you're measuring it? Could you talk about that?
So there's, as I mentioned, we kind of have this, we have found that you can talk abstractly about this concept all day and all night and people just agree with you. It sounds great. Yes, of course we need to be building communities for people of all ages and all abilities. That makes a lot of sense to folks. But it's only when you engage them on the specifics that does that begin to translate to more action. So we have had one set of work that has really been all about individual communities getting engaged sometimes literally getting their hands dirty and as I mentioned, reconstructing bus stops and putting in different lighting and organizing health groups in their communities, a whole range of smaller scale initiatives that are having direct impact, more people riding public transit, more people out walking because the lighting makes them feel safer in their communities, and gardening and eating differently. So those have very specific measurements depending on the type of work that is. But we are the regional commission. We both have the sort of privilege and challenge of having a long view. That's what we do. We're part of our group is a planning agency, and so we have a very long time horizon, and many organizations don't have that opportunity to think long into the future. So we have other measures where we're looking at, for example, how are the needs, particularly of older people, being integrated into questions of finance and into long-term plans. So when I started at the Atlanta Regional Commission in 2002, older adults were a sort of 2-page appendix on the back of a 2,500-page regional plan outlining all of the land use and transportation investments for the next 30 years. And as of the most recent regional plan, they were integrated throughout the entire document, which is just the evidence of them being integrated throughout the process. We still have a long way to go on that, and we're just embarking on a new plan. But but there has been significant change. So that's what we're looking at, is how the longer term goals are around, do we change the flow of money, and do we change the direction of investment, whether it's in healthcare, whether it's in transportation, whether it's in the physical aspects of our community, so that they are more supportive for older people.
I had one more question. Bravo on the working with PBS to reach people. I have a question. Do you have other media partners, and are the media partners paid, or do they do this in kind gratis?
So we've had a variety of partners. We had a partnership with the Atlanta Magazine, which is a well-read magazine here in the metropolitan area that kind of looks at all kinds of issues in the community, and that for a couple of years. And then more recently with public broadcasting, specifically on that, we were able to raise, and then we worked with a corporate sponsor to come up with the rest, so that was able to pay for the programming on public broadcasting. Now they matched that about 20% with their own work, so it was a combination of foundation money that we raised, the corporate sponsor, and then public broadcasting put in another set of money as well. So it was a combination of all those funding sources.
Mm-hmm. Thank you.
Okay. We have a question about the healthcare dollars you were talking about. Tina Marcanda from the Duke Endowment. Tina, would you like to ask your question?
Hi, Patty. And actually, I'm with a new foundation now. I'm with the High Point Community Health Fund. But, Kathryn, first of all, this has been an excellent presentation, and I've really enjoyed learning about the work that you've been involved with. But one of the slides that truly intrigued me was the exhibit where you showed the social determinants of health, and then kind of mapped that in terms of realignment with where dollars are being spent in terms of access to care. And I wondered if you perhaps tell us a little bit more about kind of that transformation and the work that you're igniting to help people understand how that realignment may be beneficial.
Great. Yes. So we are part of something, we've been one of the founders of, as a result of this work, something called ARCHI, the Atlanta Regional Collaborative for Health Improvement. It's a partnership that's led by us and the Georgia State Health Policy Center, Georgia State meaning Georgia State University, and the United Way of Greater Atlanta, where we have been bringing a large partnership together. I think our formal partnership includes 40 organizations now, to really look at how we spend our money in the metro area and how we need to spend our money. So it has been a partnership that's been driven by the use of a dynamic systems health model, which is a really exciting new tool that's come out of the Ripple Foundation, which is in New Jersey, but it's being used by about 7 communities around the country, us being one of them. And what the tool does is it really helps in the process of building a common agenda and common understanding of the larger healthcare issues. And we've been building a collective impact approach, which I'm sure you're all familiar with, that framework, toward how we can do healthcare change. So what the model began to show us, and this was a very large interactive experience where over a couple of months we were able to calibrate the model to be specific to the Atlanta region. So we were able to have all of the data about the healthcare status and how we spend our health money into the model. So it can be a national model where you can look at how money flows nationally, but we were able to raise the money and use some local expertise to calibrate the model so it was very specific to the core urban area of the Atlanta region. And then throughout a very large interactive workshop where we had over 80 professionals and community members come together to study that and look at the current state of our the health of the population as well as where we're spending the money, and then use the model to develop alternate scenarios. So what you can do is say, well, if we began to spend money this way, what would happen? How would we reduce premature death? How would we reduce emergency room visits? How would we increase workplace productivity or health care per capita costs? There's a number of indicators. And then you run the model over and over again until you get to a scenario that gets you the best results. So you are actually able to play out over we did a 28-year horizon, how you could change the health status of the community. And I settled on a very specific scenario, which was really the biggest bang for the buck, and where in the Atlanta region, if we begin to invest differently in 3 core areas, care coordination, changing healthy behaviors, and what the model refers to as pathways to advantage, but it's really economic stability, we can have a dramatic impact on the health of people in the region. Right now, in just the 2 core counties of the metro area, we spend $11 billion a year on health care, and each year we are less healthy than we were the year before. And so we know that if we can spend money in those 3 areas, we will be able to make a difference. And so we've come together as a partnership and have a pilot community where we are beginning to employ the strategies in all 3 of those areas to begin to witness the results. Interestingly, one other sort of side element of using this very sophisticated but easy to understand dynamic systems model is that we're at the Atlanta Regional Commission, and so we're in charge of doing the economic modeling for the metropolitan area. And we were then able to take the results to say, okay, if we make these changes, what would our world be like? What would the region be like by 2040? How would we have improved? And then we could put those improvements into the economic model and begin to better understand the economic impacts of making this kind of health change. So it's been very, very exciting, and I'd be happy to send you more information about Archie. It's been a very different way of looking at the issues and bringing people together and using data in a way that we hadn't as well before.
Thank you so much, and I would love to continue the conversation, so thank you for offering to continue to help me learn about your process.
Great.
All right. We have time for 1, maybe 2 more questions. Does anybody have any other questions or comments or whatever?
This is Tom Esselman. I came on the call kind of late with the Institute for the Ages in Sarasota, Florida. I don't have any questions to add. I just wanted to let you know that I've been on for a while.
Okay, well, we're glad you joined us because we'll be hearing from you more in July.
You bet.
Okay.
I'm looking forward to it.
Kathryn, can't thank you enough for sharing all of this with us. I think it's been very helpful to everyone, and to learn what's been going on in Metro Atlanta and what the plans for the future are. It was definitely informative. In about a week, we should have this up on the web, and I'll send the registrants a direct link to that. And I hope you can join us in July. The engagement webinar will again be on the 3rd Wednesday, July 16th at 3 p.m. Eastern, 2 p.m. Central. The Patterson Foundation will host a program that will be presented by the Institute for the Ages out of Sarasota, and I look forward to connecting with you then. So thank you for being with us today. Bye-bye.
Thank you.
Thank you.
Thank you.
Mm-hmm.